Good afternoon, everyone. I'm Avon Fire Chief Bob Spur. It is Friday, April 24th. It's about 1:30 in the afternoon, and we're coming to you with the Friday COVID-19 update. As always, I'm joined by...
Kathleen Waldron, health agent for Avon.
Hi, Kathleen. So, like we always do, we'll start off with a quick recap of numbers. Nationally, there are 894,552 positive cases and 50,455 fatalities. In Massachusetts, we have had 46,023 positive cases and 2,360 fatalities. Kathleen, how's it look locally?
Sure. Norfolk County has 4,541 positive cases. Plymouth County has 3,529 cases, and Avon has 44 cases. And I just want to go over what the numbers actually mean. It's a cumulative number from the beginning of when we started seeing positive cases until now. We don't currently have 44 positive cases in quarantine at this moment. There have been people who have recovered, who have gotten past all the symptoms and have been released from isolation. So I hope that helps people understand what these numbers mean. And that goes for the state too. They're cumulative numbers.
Right. So we use that number because that's the most accurate number we can get. If we try and subtract out at the state or national level, subtract out recovered or non-active, not everybody's counting them the same. But a positive case is a positive case. So that's why we've chosen to use that cumulative number, because that's the one that's consistent along with fatalities. That's the consistent number across it. We're just trying to keep everything the same everywhere. Kathleen, you guys put out an order the other day. You want to talk about that again and just let people know?
Sure. It was an order that was sent out on Wednesday. It's effective as of today, but anyone that is entering a public building needs to have a face covering of some sort. It could be a face mask, it can be a bandana. It should have multiple layers. That does help. So anyone entering needs a face mask, and then any employee should also be wearing a face mask. There's the whole order is on the town website if you want to read all the guidelines, but that pretty much sums it up. And if you're working in a building where you can't keep a social distance of 6 feet, then anyone working in that building should also be wearing a face covering of some sort. And there's also a way on the CDC website to make your own face covering if you don't have one.
Great. So town facility status is the same. Nothing has changed there. Is there anything else folks need to know?
Just continue doing what you're doing. Social distancing, staying home when possible. The mental health piece too. If you need help, there's definitely resources out there, reach out to somebody, go online, find something.
Okay, so the thing I want people to know is the hospitals, we and the hospitals are here for you. There's been a notice lowering of people seeking help for things that COVID should not have made go away. And I'm specifically talking about things like chest pain, cardiac problems, strokes, things like that, medical emergencies that are not dependent one way or the other on COVID. We're very worried that people are not seeking care for them in a timely manner. And those are things that really time does matter. So if you're having chest pain, if you're showing signs of a stroke, speech, vision impairment, arm drift, things like that, please call 911, seek care. All the emergency departments in the area are set up so that they've got areas separate from where the COVID patients are so that you can safely be treated there. So if you're having a medical emergency, please call us or go to the hospital and get treated. Don't wait for this, because these are things that are just not going to get better. We've seen the numbers fall off and there's no reason for it. So we want to get you treated sooner rather than later. Other than that, Avon, you're doing great. Keep up the good work. All right. Have a good day, folks. We will see you Tuesday.